Hi Broomfield teens! Welcome to another episode of Sincerely Teens, where Y4Y members share information about substances, resources, and community actions with the goal of addressing inaccurate facts about them. I'm Lydia.
I'm Serby.
I'm Emily. And I'm Saba. Y4Y is a group of teens dedicated to helping the community support positive relationships, fight misinformation about substance abuse, and improve mental health. We also empower youth to advocate for their own needs.
We are super excited to continue our previous episode on vaping, and we are honored to introduce the guest speaker interviewed today, Adrienn Hollonds, in our podcast.
She is the public health educator at Broomfield Public Health and is active in the field of tobacco use education. Welcome, Ms. Hollonds.
Can you give us a brief history of how vaping has evolved?
Absolutely. Cigarettes first entered the market in 2007 and have continued to evolve since then, with the original versions designed to resemble regular cigarettes, cigars, pipes, and pens. E-cigarettes next evolved into pod mods, with e-liquid sold in disposable pods. In 2015, the emergence of the brand Juul took pod mods to the next level, with high-tech design, high nicotine delivery, and youth-appealing marketing that hooked a new generation to nicotine. Today's rapidly evolving cigarette market, now most commonly referred to as vapes, includes many varieties of disposable and single-use vapes. The latest vapes also contain some of the highest nicotine levels ever seen in tobacco products. Even those that claim to be tobacco-free include lab-created synthetic nicotine products that still contain nicotine.
What chemicals are in vape juice, and how do they affect the body?
There are at least 60 chemical compounds that have been found in e-liquids, and more are present in the aerosol produced by vapes. Because the Food and Drug Administration has not reviewed or issued any standards on the products, vape composition and the effects they have vary. What researchers do know is that the toxic chemicals and metals found in vapes are harmful to all body systems, especially the neurological, cardiovascular, and respiratory systems. The neurological system is affected by nicotine's harm on the developing brain because nicotine is highly addictive. It disrupts the development of the brain circuits that control attention, learning, mood, and impulse control. It affects the brain's reward system, priming it to be more easily addicted to other harmful substances. The cardiovascular system is impacted by nicotine by causing impaired blood flow to the arteries, which could lead to cardiovascular disease. And the respiratory system is affected by aerosol that contains carcinogens and heavy metals like lead and arsenic, volatile organic compounds, and ultrafine particles that can be inhaled deeply into the lungs by users and bystanders.
What trends are we seeing recently among who is vaping?
Despite recent overall downward trends in tobacco use over the past few decades, it remains the leading cause of preventable death and disease, and certain demographic groups continue to be disproportionately affected. Youth vaping was the most frequently cited concern by all community members in our 2023 tobacco-focused community assessment. And while recent policy changes have been enacted locally and at the state level, it will take time for their full impact to be seen. We know that youth of all backgrounds vape, and this shows up in our data. However, we see disparities for youth who are part of the LGBTQ+ community, which is a concern for us and something that we're working to address.
What are your biggest concerns regarding vaping in Broomfield?
Any tobacco use is a community concern for us. The City and County of Broomfield uses data to identify trends, both good and bad, in the community, and youth vaping has continued to rise to the top as an area of concern. Access, the impact vaping and tobacco use has on the developing brain, physical and mental health, and depression and anxiety are some of our biggest concerns. The trend is not only seen in Broomfield, but across the United States, where the U.S. Surgeon General declared youth vaping an epidemic. At the time of the declaration, more than 3.6 million youth were using vapes, most of whom were non-traditional cigarette smokers in the first place, and are now vulnerable to long-term nicotine addiction.
What are some good resources available to teens?
I would advise teens to talk to their healthcare provider about ways to get help, through counseling, group support, assessing if nicotine replacement therapies would be appropriate, and enrolling in a tobacco cessation program. My Life, My Quit and the Colorado Quit Line are tobacco cessation programs that are free, evidence-based, and offer help for quitting all forms of tobacco, including cigarettes, vaping products, chewing tobacco, cigars, and they're recommended by the State Public Health Department.
Do you think there is anything that can be done to cure the effects of vaping after you quit?
That's a great question. It's never too late to quit using tobacco. No matter your age or how long you've been vaping, quitting improves your health in the years ahead and greatly reduces your risks of smoking-related illnesses.
In your opinion, what is the most harmful effect of vaping?
For youth, the most harmful effect of vaping is the effect nicotine has on the developing brain. We know that the brain is still developing till at least the age of 25, and when you introduce nicotine, a highly addictive chemical, to a young developing brain, it can disrupt the development of the brain circuits that control attention, learning, mood, and impulse control. And that can lead to problems with paying attention, being able to learn, and can cause changes in mood like depression and anxiety. Nicotine can also affect the brain's reward system and cause young people's brains to be more easily addicted to other unhealthy substances, basically priming the brain for addiction.
Does vaping give a secondhand smoke effect similar to how cigarettes do?
A myth about these products is that they emit a harmless water vapor. This is not true. The combustion of the e-liquid yields an aerosol that contains nicotine, fine and ultrafine particles, and heavy metals, including nickel, lead, and tin. There are known health impacts from using these products and being at close proximity to someone who is using them. Think about your home environment or in motor vehicles, including impacting the respiratory system, the cardiovascular system, neurological system, and potential for the device to explode and harm the user. Explosions are rare, but they have been covered in the media, and they are typically caused by defective batteries.
What are the current regulations on vaping in Broomfield, and do you think they are doing enough to prevent it?
Broomfield was an early initiator in passing policies to make the community a safer place to work, play, and live. To address the youth vaping problem, many cities across Colorado have passed local tobacco control policies. In Broomfield, our city council passed 2 ordinances. The first was retail licensing and increasing the minimum purchase age to 21, and the second was prohibiting the use of tobacco and vaping products in outdoor public areas, like parks, playgrounds, and other outdoor dining areas, basically places where families and young children gather, so smoking and vaping are not as visible. There are now over 30 cities in the state that have passed local licensing requirements, many of which raised the minimum sales age to 21 before the federal government did in 2019. And limiting public places where smoking and vaping are allowed. All of these things have been shown to be effective in reducing youth access to tobacco products and the use of the products. And then because of the local ordinances being passed, this led to support at the state level, and the result was the passage of the state tobacco retail licensing in Colorado. I think there are always areas for improvement, both at state and local levels.
What is the harm of not properly disposing of vapes? Where can vapes be disposed?
Vape devices and e-liquid are hazardous waste and need to be stored and disposed of safely. The batteries have been known to explode, causing burns, fires, and other risks to people, animals, and the environment. Liquid nicotine is poisonous and has caused illness and death in pets and small children. Boulder County, the city and county of Broomfield, and town of Erie residents can dispose of e-waste for free at the Boulder County Hazardous Materials Management Facility.
So, how do vaping and tobacco companies target youth?
Vaping and tobacco companies target youth through marketing. Vaping companies are using the same tactics that tobacco companies use to target youth. So think Joe Camel. A lot of marketing is done on social media. Additionally, they target youth with being easily accessible. The fruit flavors are very appealing to youth. Perception that it's not as bad as smoking cigarettes or a healthier option, which is not true. Easier to hide, and you can vape more places and go undetected.
What are some ways that Broomfield Public Health is addressing youth vaping concerns in the community?
Broomfield Public Health writes grants and receives funding from the state to focus on tobacco prevention and cessation efforts. In response to concerns shared by youth, partners, and community members, we engaged with young people to create a campaign that jointly addresses vaping and youth mental health, and it promotes My Life, My Quit, a cessation program for teens. Some additional ways that Broomfield partners to address vaping concerns in the community include the Handed In event, which brings awareness to the larger community on youth vaping trends and provides youth with an opportunity to turn in their vape or other tobacco vice in exchange for a summer pass. This was our 4th year, and we collected 81 tobacco products and distributed 33 passes. Additionally, we partner with schools sharing cessation materials and provide them with hazardous materials collection bins for safe disposal of collected vapes and tobacco products. We work with various city and county of Broomfield departments to make sure that retailers are following laws and being compliant with rules and regulations. We provide content expertise to the City Council and the Board of Health. We also provide tobacco education and outreach at school and community-based events where youth and their families frequent. We were recently awarded an additional grant that will connect young people who vape with more quitting help.
What could be added to strengthen prevention efforts and support youth?
Strengthening efforts should include state and national bans on flavored tobacco products. There are currently no flavored vaping products approved by the FDA. That means that thousands of unregulated products remain on store shelves, many in youth-appealing flavors such as gummy bear, and that's posing a threat to young people's health. More education and resources for safe storage and handling of tobacco products. From 2013 to 2016, there was a 250% increase in calls to the Poison Center about vapes. Most calls, about 66%, to the Rocky Mountain Poison Center about vapes were concerns about children under 5. Nicotine poisoning can happen when nicotine is inhaled, swallowed, or absorbed through the skin. Pets and children need to be kept safe by keeping devices and liquids out of reach. Safe disposal. E-waste, liquids, and batteries that are part of the vaping system need to be properly disposed of. We need to raise awareness of the importance of proper disposal of vaping devices to prevent environmental impact, fires, and accidental exposure. We need to provide solutions for schools, retailers, and the community. More cessation resources, peer support, and options for nicotine replacement therapies to help youth quit who already vape. My Life, My Quit is a great resource, and we need to bring more awareness of it in the community, and that would be really helpful. We also need more opportunities for youth voice and advocacy for change at state and national levels.
Thank you so much for all of the information you have shared today.
Before we finish, don't forget about the free upcoming Y4Y community event on August 5th. It will be an open house on the second floor Eisenhower Room at the Broomfield Library from 5 to 8. Join us for painting, food, and hanging out. You can find more information regarding this event on Youth for Youth's Instagram page and the City and County of Broomfield Public Health's Facebook.
That's all for today, Broomfield teens. Thank you for tuning into this Sincerely Teens interview episode on vaping by Y4Y and our guest speaker, Adrienn Hollonds.
Check out our Instagram at Broomfield Y4Y to learn more. We look forward to sharing more information in the next episode.